Hi everyone, so I'm here with a 7-week postpartum update. I had been meaning to do one sooner, but life gets busy with a newborn. We do have two other kids also, so making that transition from 2 to 3, especially when it's been years since you had a little baby, it does become a bit challenging. We have an 11-year-old son, and then we have a 6-year-old daughter, and then we have her. So if you don't know, I had a C-section with her. It was a planned C-section because I had a C-section with the other two, which started from having an emergency C-section with my son. He had a decreased heart rate, so they had to go ahead and end up taking him via cesarean. And then with my daughter, I was going to do a VBAC, but then she never dropped down. So ended up having to do a cesarean with her, which automatically made me have to have a cesarean with her because they don't do VBACs where I'm from after the second cesarean. So had a C-section, and the pain was what I'm used to because I've had one, so the pain wasn't, a big shock. But I did feel like I did better this time around with my C-section. As far as my pain level, being able to tolerate getting up, walking, and because after you have a C-section, they encourage you to, get up and move and, just try to be more active. And so they took my Foley out probably about 12 hours after. And I got up out of the bed, got moving, went to the bathroom, got cleaned up, sat up in the chair for a while. And then the next day is when I started, walking up and down the halls. I had her on a Tuesday, and then I was discharged on a Friday. So we were in the hospital for 3 days. Pretty standard for a C-section. So, got home, and once I got to the pharmacy to fill the med, I found out that if I was breastfeeding, they advised me not to take the med. So because I was in a lot of pain, I decided, okay, well, I'm just going to pump and dump and, supplement with formula until, I could tolerate my pain. Well, that didn't work. I did get really, really engorged, and then also she didn't tolerate the supplement very well. She was having so many stools a day. I'm talking like 15 to 20. Her bottom had the skin literally peeling off. She was raw. So this started Sunday. So I decided that I just would forego taking the pain medicines and, just breastfeed because I want to do what's best for baby, even if it's at the expense of my comfort. I want for her to be, okay. So I stopped taking any kind of pain meds. That did make my pain level spike because I didn't have anything to help with that. I'm not a Tylenol person. Tylenol doesn't do anything for me. I do take ibuprofen, however, but due to, this is the spit up queen, you guys. She has really bad reflux. But the doctor said it's just, her growing out of it. She's my only baby that I've had to have reflux like this. My other two didn't have reflux like this. But, so I do take ibuprofen. But around the time that I had her, they were saying that ibuprofen wasn't good for you to take, with the whole COVID situation, because they were saying that it acts as a binding agent. So I didn't want to take the ibuprofen because I didn't want to put myself at more risk for, getting COVID. Which we've been staying inside still, with her being so little. And then I have asthma really bad. I'm a really bad asthmatic. So if I was to get COVID, it would probably, really, really take a toll on me. And then also with her, Mari, he also has asthma really bad. So we're all just trying to, just stay in and stay safe and, keep from, around crowds of people because we don't want to get sick because we know that it could be really detrimental to our health. So I didn't take anything, no types of pain medicine. So the first week and a half, 2 weeks was very rough. as far as pain. But after that, the pain got better. As far as my incision and healing, my incision, I did end up getting an infection on the right side of my incision, and I was prescribed some antibiotics for it. I also had a UTI, so they kind of worked hand in hand, which is, a UTI is common after you give birth when you've had a Foley placed. That's a common infection to get. So I did get a UTI. I did have an incisional infection, but that has seemed to heal up. After giving birth, I did have some extreme swelling, which I had that also with the other two. But this was the first time that I had swelling all over after giving birth to her. So prior to becoming pregnant, I was on a medication that helped with fluid retention because I have hypothyroidism. So when you have hypothyroidism, it causes you to have swelling of the extremities. And so I had been on what they would call a water pill to help with the swelling. So I did reach out to my OB and asked him to prescribe me, the medication that I was taking before to help with fluid retention. And so that helped the fluid retention go down. Bleeding. Lots of bleeding. I think I had the most bleeding with this baby that I've ever had. And usually, my bleeding stopped, between 3 weeks, 2 and 3 weeks. But I am still now, even at 7 weeks, having some spotting. I did speak with my doctor when I went, and he, didn't see, anything wrong with it. Just said, different, every pregnancy is different. And so, it didn't, it wasn't a cause for alarm to him that I was still spotting. So I guess I just gotta go with the flow and, see where that is. When I hit 4 weeks, I did have some clotting, like really, really big golf ball size clottings. But I did reach out to them, and they said that it was okay, that, sometimes, where the placenta is attached, it tends to slough off. So they didn't see, anything, but they did say that if I began to get extreme pain or, a spike of fever with it, then, to go to the nearest ER. So we didn't give birth here in Georgia. We gave birth in Florida. I used the same OB that delivered my other two. So we used the same OB. Unfortunately, he wasn't able to deliver her because he had to have a COVID test. He had a COVID test that Saturday, and then they told him, the results will be back, within 24 to 48 hours. Well, he didn't get his results back till Thursday. So because he didn't have his clearance, he wasn't able to deliver her. So, it's kind of a bummer because, he delivered the other two. Like, I've had this OB-GYN, since I was 15 years old. So, we have a long history together. So, it was kind of upsetting that he wasn't there to deliver. But then I'm also glad that, his test came back negative and, he didn't have anything wrong. So, yeah, I'm exclusively breastfeeding. I did have, like, horrific engorging, maybe 4 to 6 days after. Days 4 through 6. It was horrific. Like, this breast, I couldn't get anything out of it. I mean, I tried the shower. I tried soaking it in a bowl of warm water. I tried self-expressing. I tried pumping. I tried everything. I couldn't get it to, release. So I did have an appointment with her doctor. So I asked her, what was the best, thing for me to do. So she suggested that instead of me using an electric pump, she suggested that I use a hand pump. So I had Glenn go and get me a hand pump. And after like a day or two, I was able to start expressing some milk out of that breast, and then I began to, get relief. It does get a bit discouraging when you go through having engorging like that, because you do want to stop, but then at the same time you want what's best for baby. And they always say breast is best. So I did endure, even though I did want to stop, I did endure. And I I felt like I would be cheating her if I didn't, because I breastfed with the other two, so I wanted to make sure that I gave her the same advantage that I gave them. So yeah, so I did deal with the engorging. But after I was able to get some of that milk to express out, it was much better. I had the whole cracking of the nipples, it was raw. Like, my nipples were raw. They were it was a lot of pain. Like, I think it was might have been worse than the C-section, because they hurt so bad. And when you're sore and you're in pain, and then you're still trying to feed your baby, when they latch on, it makes it even worse. So I did get past having the breast engorgement. I think that was by far the worst engorgement that I had experienced, even with my other two pregnancies and delivering. I didn't deal with the breast engorgement with them. I think it might not have been so bad had I started off breastfeeding instead of trying to pump, because at first I was going to take the medicine, but then once I found out that I couldn't, because of her intolerance to the formula, I feel like maybe had I been breastfeeding all along, maybe it had wouldn't have been as bad. But you live and you learn. Depression. I haven't had extreme depression. I will say with my other daughter, the 6-year-old, I had really, really bad depression. Like, I couldn't tell you why I was so upset. I couldn't tell you why I was miserable. I couldn't tell you why I wasn't happy. And it wasn't to the point where I wanted to hurt myself or hurt her, but I just wasn't happy. I couldn't bring myself out of that slump. This time around, I think it's more so depressing that we don't have family around due to COVID-19. When you give birth, that's experience that you want to share, with your whole family. And being that we're not able to share, this part of our life with them, that does get depressing at times. With us being far away from family, we're 2 hours away. So, we haven't seen anyone. Elena hasn't met, family members. She hasn't met, grandmas and all that, and grandpas and, aunties, uncles. So, it is a bit hard. She did meet her grandma and grandpa on daddy's side, because they brought the kids home once we came home from the hospital. But, other than that, she hasn't met anyone. So that does get, depressing, not being around family. But other than that, that would probably be the only thing, that I would say gets me down. Nothing, not anything like it was with Brianna. So weight. This is something I have been struggling with, and I guess I could say that kind of gets me down also. So with my past two pregnancies, I'm used to losing, weight. With my past two pregnancies, I lost 40 plus pounds. With this pregnancy, I didn't lose, as much. I did lose throughout the pregnancy, but then I kind of gained back weight towards the end of pregnancy. And so, now I'm only, I would say, maybe 15 pounds down from what I was before giving birth. But I'm still about 15 pounds heavier than I was before giving birth. So even though that's not a whole lot, it does kind of, because your body changes when you have a baby. So, yes, the weight is almost the same, but then your body is shaped differently. You're not as tight or firm. I do feel like jiggly. I do have that extra, what they call spare tire, and so that is something that I plan on working on, trying to get back down. Before I got pregnant, I had actually lost 60 pounds, and that was part of, me trying to be able to have a baby. That's another story for another day, our journey, with infertility and all that. But yeah, so I do know that I'll be able to, drop the weight. But I do know that it's going to take time. Last week I told my husband, I said, well, I'm just not going to worry about, trying to push, weight loss. But then even that still, even with me saying it, I still feel like I should be pushing weight loss. Because, if you're not happy with your image, it does get you down. Even though I have to also understand that I did just give birth, so I know that it's going to take time. I know that I'm not going to be, right back to where I was before, becoming pregnant. But, yeah, so that's something I got to work on. I think it just kind of spoiled me with the past 2 pregnancies because I did lose, such a tremendous amount of weight. And then to get to this one and not really lose anything, But I will say, with, the bright side of not having the weight loss is that I didn't have the sickness. With the other 2, I was sick from the very beginning to the day I gave birth. And then, with Elena, I didn't have much sickness. Like, I might have been sick like maybe 2 months, out of the whole pregnancy. And then, of course, you have random bouts of nausea. But, I might have been sick for like 2 months, and that was that. So I will say that was the plus side of, not losing weight, because I didn't have to suffer and be sick the entire time. Sleep. We don't get much sleep around here. She sleeps now. She sleeps during the day, and then she's up at night. She is definitely a night owl. She's also a colicky baby, so her sleepless nights come with a lot of screaming. But yeah, so don't get much sleep. It wasn't as bad before, Glenn went back to work, because he was home with us for 4 weeks, and that was heaven. Being able to have, him here to help and assist and everything. Like, I didn't have to really lift a finger. All I did was just, take care of her. So it was quite a bit of a transition with him going back to work. He went back to work when she turned a month old. So, I've had, 3 weeks to kind of adjust, which it's not bad. I mean, and then it is beneficial that he works Monday through Thursday. So, I go without sleep Monday through Thursday, but then, I'm able to, catch up and get rest on the weekends, which is great. And I know a lot of people don't have that support, so I am thankful that I have that support and have someone that's willing to, help, because, not all fathers are involved. So, that is a blessing in itself to have someone that is willing to, help out, someone, that doesn't mind, because not all fathers are willing to do that. Not all fathers are present. So that is a blessing. So, yeah, so I've adjusted. What we normally do is, she normally gets up around 11, and then she cat naps. Like, she takes little 5-minute naps or whatever, throughout the night. But then we go to bed at 7 a.m. So we do a full 11 to 7 shift most nights, because that's just her sleep schedule. She is just, she still has her days and her nights mixed up. So yeah, so we pretty much do a full 8-hour shift. It is kind of hard, trying to remember how to parent a newborn, because I do have such a big gap in between my kids. Like I said, we have an 11-year-old, we have a 6-year-old, and now we have a newborn. So it is different, because it's been so long, and things change, over the years. Like, it's different when you don't have them back to back to back, because so many things change, so many different guidelines, when it comes to babies. So yeah, so it has been a bit hard, and I do feel like at times like I'm a new parent, brand new parent, even though I have 2 kids. But like I said, because it has been so long, it does seem like we're new, like we're first time parents. So yeah, so we get our sleep. We sleep, well, she sleeps throughout the day, but usually I sleep, from 7 to 11:30. And I am thankful that I have older kids, because I don't know how I would deal if I had toddlers, 2 other toddlers and then a newborn, as far as getting rest, because I will say that my kids are pretty good at being, self-sufficient. They don't need much. Now, we do homeschool. So usually what I do is I get out their work, and I let them know, if there's anything that you need help on, you let me know, and I'll help you, once I wake up, because they kind of like to get on their work early instead of waiting on me to wake up at like 11. Big brother, he makes sure that little sister eats. So I am thankful for that, for him, being so helpful. And then it's just a big help when you have someone around, especially since it's just us here during the day. I do appreciate that he helps out so much, because even if I need to like hop in the shower or whatever, I can hand him off to her. I taught him how to pick her up safely, and how to hold her safely, and he does a great job doing that. So even Bree, like if I need to like run to the bathroom, I say, watch your sissy really quick, and I run to the bathroom and run back or whatever. And they do a really, really good job helping me out. So I am thankful for that. I'm thankful that I have that help, especially when Daddy's not here to help, and he's at work. Now me going back to work. I'm a nurse, so my original plan was for me to go back to work, actually like now, when Elena got 6 or 7 weeks. That was my plan, for me to go back to work. But due to the current world events, with COVID-19 and everything, I don't feel like it's in our best interest for me to return back to work, especially with having such a little baby. Because I would never forgive myself if I was to bring something back home to her. And so, I just want her to be a little older, get her immune system stronger so that she's able to, fight off anything, if I should bring something back home. So I'm not really sure when I'm going back to work. At this point, I'm kind of thinking like July, August, maybe I'll go back, because, she'll be 3 months at the end of June. So, I figure maybe July, August, is when I'll probably go back to work. That's when I think I would feel better about going to work, and, knowing that she's a little older and that she can better fight off, whatever I may bring back home, which hopefully I don't bring anything back home. But yeah, so that's where I'm at as far as work. But yeah, so recovery has been, pretty smooth for the most part. It hasn't been anything extreme. We've just been taking it pretty much one day at a time. Life does get busy and hectic at times. We did have one day where I had both of my little ones crying. Like I had the 6-year-old crying because the doctor thought it was pink eye, but I don't think it was pink eye, because it was only like a day that it lasted, if that. I think she just got something in her eye that scratched her eye, and that was what caused the redness and the swelling. But I had her crying, then I had her crying, and it was just horrible. Elena doesn't ride well, but we had to pack Elena up and run to the store so that I could get Brianna some eye water, and it was just a mess. So I said I could only imagine if I had 2 little ones. Like, I'm thankful that our kids are spaced out. Like, I always said I wanted my last 2 kids to be close together, but this does make me truly thankful that my kids are, spaced out. Gives me time to breathe, which is what a new mother needs, is, time to breathe. So, yeah. So, I will update you guys, in a couple of weeks and let you guys know how everything is going. As of right now, like I said, we're just taking it, one day at a time. And I actually am going to, get ready to start working out. Not, anything, strenuous, but just, start, exercising and gradually, build myself up. But yeah, so that's where I'm at, with recovery, and everything is pretty much going well. I don't have any major complaints. Recovery was pretty smooth sailing, besides that little bout of, infection that I had, the engorgement. But, recovery, it's been okay. It's recovery. So, you can't expect it to be peaches and cream, because it's really not. Your body really goes through something traumatic when you, have a baby and you give birth. So you just have to be patient with yourself, be patient with your body, you know, give yourself time to get back to you. I will say I do feel like I am starting to get back to the old me. Like I'm more energized, even though I don't get sleep, but I do have my energy back. You know, I don't feel sluggish all the time. You know, I just feel like I'm getting back to me. So, you know, I am recovering as I should be. But yeah, so that's enough about my, you know, postpartum recovery so far. You know, I'll keep you guys updated. I'll probably do a 3-month postpartum, you know, just to let you guys know where I am. And so yeah, that's that. I thank you guys for watching. If you haven't already, make sure you guys like and subscribe. Don't forget to hit that notification bell. And yeah, we haven't been posting a lot on our channel, but like I said, you know, it's been kind of busy and hectic, but we do plan on getting better with posting. We do strive and want to, you know, begin posting weekly videos. So just bear with us, you know, we're gonna get there. So yeah, just bear with us, and you know, we thank you guys, the ones that have subscribed, and anyone that hasn't subscribed, please don't forget to like and subscribe and hit the notification bell. So yeah, so that's it for this video. I thank you all for watching, and bye.